Hello, my name is Krista Moore Torres, and this is my presentation about preventing cardiovascular complications in incarcerated diabetic patients. Diabetes is a disease that affects the use of glucose by the cells in the body, either because of the lack of insulin or because of the ineffective use of insulin. The CDC tells us that diabetes type 1 is normally diagnosed early in life in children, teenagers, and about 5% of the adults diagnosed with diabetes. The CDC also tells us that type 2 diabetes accounts for 90% to 95% of all diagnosed cases of diabetes in adults. Gestational diabetes occurs in pregnant women. As for cardiovascular disease, the American Heart Association defines cardiovascular disease as a number of conditions that affect the heart and the blood vessels. These conditions include heart disease, heart attacks, strokes, heart failure, arrhythmias, and heart valve problems. Diabetes is one of the most common chronic diseases in the United States. Complications from diabetes are not only disabling, but can also be mortal. Many of these complications are related to cardiovascular disease, which encompasses multiple conditions that affect the heart and the blood vessels. The American Heart Association estimates that 68% of patients suffering from diabetes and older than 65 years of age will die from some sort of heart disease, and 16% of them will die from a stroke. According to Laxo and Cusitos, the relative risk for coronary artery disease is essentially high in patients with type 1 diabetes. In these patients younger than 40 years of age, the risk was tenfold higher than that of the general population. For patients with type 2 diabetes who have suffered the disease for over 10 years, the risk for coronary artery disease seems to be similar to a non-diabetic patient with a history of cardiac infarct. Diabetes mellitus does not cease to be one of the most urgent medical and social problems in modern society, and it is not different for incarcerated patients. Despite the fact that diabetes incidence is predominant in incarcerated patients, interventions available for community-dwelling adults with diabetes do not necessarily transfer to incarcerated patients. The Florida Department of Correction provides incarcerated patients with an ample amount of health benefits. For as long as inmates are under the custody of the Department of Correction, they have access to medical, dental, vision, and prescription coverage. They also have access to medical care 24 hours a day, 7 days a week, and periodic follow-ups for patients with chronic conditions such as hypertension, diabetes, and seizure disorders. All these services are provided at no cost to the patient. The literature review reveals that an important part of health promotion for diabetic patients includes diet and exercise. Although a challenge with incarcerated diabetic patients, changes in activity levels and diet are possible. In this regard, SANE found that special health diet provisions are incorporated in many states' food service menus and include renal, hepatic, diabetic, low sodium, low cholesterol, low fat, and cardiovascular diets. In order for patients to receive these diets, a healthcare provider or a healthcare personnel must prescribe it. Regardless of the prescribed diet, and despite the evidence that patients benefit from individualized diet plans, diabetic patients in corrections do not receive individualized diet assessments. The literature review also supports a modification to the frequency in glucose level monitoring required to control diabetes as a means to prevent the incidence of cardiovascular complications. In this regard, the Mayo Clinic recommends monitoring glucose levels depending on the type of diabetes and depending on the patient, as each case is unique. More research should be done to determine the impact of these changes in incarcerated patients. Leadership styles are defined by Asami, Knapp, and Ansa as the behavior pattern of a leader or an individual who attempts to influence others. In nursing, the leadership styles that have been commonly used over the years are autocratic, transactional, and transformational leadership. Based on the nature of the nursing profession, aspects such as safety and patient outcome are crucial. In this regard, according to Squires et al. And Fisher, transformational leadership is central to nursing because of the influence on a safety culture, staff satisfaction, and patient outcome. In correction, changes to improve diabetic outcomes to prevent incidence of cardiovascular disease must be introduced by leadership and must be accepted and embraced by personnel. Transformational leadership seems to be the most effective style to implement such changes. Nursing, like many other professions, is in a constant change. Evidence-based practice is the precursor of many of the changes experienced in nursing. In the pursuit of better patient outcomes and higher patient and staff satisfaction levels, theories regarding how to promote such changes have emerged. An important change theory is that of Kurt Lewin, which proposed that in order for a change to occur, the organization must go through 3 different stages: unfreeze, change, and refreeze. In corrections, the initial unfreeze stage may prove challenging, as most of the elements of this stage are influenced by many different factors and role players. Yet, the analysis of the current situation can be done by the manager or by the nurses in charge of diabetic patients' care. The next stage in Lewin's theory, change, allows the implementation of changes to improve the current situation. Important aspects of this stage include finding out possible barriers, the urgency of the change, information regarding the most relevant aspects of the change, and the involvement of senior management and implementation team. People involved in the proposed changes must agree that the implementation is essential to determine better outcome for diabetic patients and, most importantly, the reduction of cardiovascular comorbidities in incarceration diabetic patients. The last stage of Lewin's theory, refreeze, refers to the process by which all changes implemented become permanent over time. Once the changes have been implemented, it is important to follow up and evaluate how effective the changes are. For diabetic incarcerated patients, the changes should translate into lower levels of A1C, better eating habits, and perhaps some weight reduction. Patients should also be able to voice the benefits of the implemented changes. The evaluation process should be conducted taking in consideration aspects such as patient outcome and patient satisfaction. In this regard, aspects of patient health such as A1C levels, increased activity levels, diet changes, and whether any cardiovascular complication has arisen should be noted. Patients should be able to verbalize benefits of the implemented changes. To evaluate the outcome of the leadership theory, staff should be surveyed to determine whether the change in leadership approach resulted in a higher job satisfaction and higher retention rates. The incidence of conflict among staff should also be noted as an element of this evaluation. In conclusion, there is a direct relationship between diabetes and cardiovascular disease. Diabetic patients are at high risk of developing cardiovascular complications and die as a result of it than non-diabetic patients. This is essentially true for patients whose diabetes whose diabetes is uncontrolled. Important factors in diabetes control and prevention of cardiac complications are diet, exercise, and close monitoring of glucose levels. Based on the medical resources the Department of Correction have available for inmates, a plan can be developed to determine whether diabetic patients are controlled and stable. This plan should include patient evaluation, a change to the actual approach to diabetic treatment, and patient education. This will translate in a better control of glucose levels, which should result in a reduction of cardiovascular disease. In addition, quality of life and life expectancy will also improve. Medical costs to treat complications of diabetes will be less, and the impact to society once the patients are released will also be less. In order to implement these changes, leadership must be involved and must motivate medical personnel to implement the changes. In nursing, like in any other profession, it is important to promote an environment conducive to performance. Nurse leaders are responsible for both making their team effective and achieve higher rates of retention. Like many other aspects of the nursing profession, nursing leadership is constantly evolving in search for better approaches to improve both patient and staff outcomes.